Ryan Elza, welcome.
Hey, thanks for having me, Ahmed.
Thank you for being on. I was looking at your LinkedIn, and it was not just 2 years ago where you were at AARP. How many years ago that was? Because that's when I
Oh,
met,
since I was at AARP. Oh, wow, it's been a minute.
right?
I left AARP in the end of 2020. So I was helping to lead their pandemic response, and then at the I think December was my last month at the AARP Foundation, and then I transitioned to Volunteers of America um, early in 2021.
Okay, so I've known you for something like 6 to 7 years.
Yeah, well, yeah, because we've probably known each other since when I started AARP, which was like 2016, right? So
2016,
we're
so
probably,
this is like almost 9 years.
yeah, almost a decade together,
Oh,
my friend.
wow, wow. Okay, well, I didn't know that we were that close.
Yeah.
No, I really admire your work. Been following. Can I say now I've been following since you were a much younger man?
Yeah, that's right. I'm still going to claim to be a younger guy, as long as
Yes,
I can
yes.
claim it.
Now, since you were green, you were much greener. Let's say, let's put it that way. Even when you were green, you were pretty impressive as someone who cares a lot about what you do, and who has maintained that. Like you haven't gone sarcastic or cynical about life. And I think you have every right to become cynical given what happened lately, right? So
Yeah.
tell us the story if you could about what is it called officially that you would take it from the government? What is that called?
Yeah, so I opted into the deferred resignation
Deferred
plan.
resignation. Right.
So yeah, so for those who tuning in, I had the honor and pleasure of serving as the principal lead across the federal government for housing and services. So I worked within the Department of Health and Human Services at the Administration of Community Living, whose mission is to ensure that all individuals, regardless of age or ability, have the full supports and services that they need to live full and independent lives in the community. So I led a partnership between HHS and the U.S. Department of Housing and Urban Development, and a total of 17 federal offices and agencies, really around this mission of making sure that older adults and people with disabilities had access to affordable, accessible housing and support and all the supports and services that they need. So it was a really great opportunity to kind of come in and lead at the federal level and really think about how we can re-envision and reimagine our systems within the US, both at federal and state level, and kind of what are those mechanisms and partnerships that can be leveraged to really help ensure that everyone, has everything that they need in order to live great lives was really kind of our mission and our goal.
Yeah. Um, and then before that, let's go back to ARP because I think the work you were doing there was important. It was focused, I believe, on social isolation, right? If I remember
Yeah.
correctly. Um, and then tell me how you got to be doing what you're doing. Meaning, you went to college in University of Maryland. What did you major in?
Yeah. Anthropology.
Anthropology. Yeah,
Yeah.
I
Yeah.
respect that discipline very much. So how did you get from there to caring about seniors and about housing? Was it something that you had in you before, or is it something that you acquired as you went through these jobs?
Yeah, I mean, that's a great question. And so my career and focus has always been on the social drivers of health. So in my undergrad, I actually started a chapter of a nonprofit called Health Leads. Well, at the time, it was called Project Health, that trained to mobilize undergraduate students to be family advocates for low-income individuals. So helped to build out the Washington, D.C. site, which here in D.C. was at Children's National Medical Center, both at their main hospital and then their satellite clinic at 25th and Good Hope Road in Anacostia. So that was really inspired by some of my own lived experience. And so my sister growing up had multiple chronic conditions. And when she graduated from high school, she didn't move on to college, and it was a time before the Affordable Care Act was passed, and so she was unable to be covered by my mom's health insurance. And so, kind of seeing the complexities of having chronic conditions, not being able to work, and not having access to healthcare coverage, really saw that there's a lot of fundamental flaws in the way that health and healthcare works in the U.S. And so that motivated me to really figure out what could I do on an individual level to help people who were struggling with navigating these really complex systems access the types of programs and benefits and resources available to them in order to improve overall health and well-being. So during that time, with Project Health and then Health Leads after the rebranding, grew that to a 40-person, 40-hour per week, 80-person volunteered staff desk there, in which we screened patients who are coming into the clinics and the ER for the social determinants of health. Now I think we're going on a rebranding of the social determinants of health now. They've, had a lot of changes in names, but really trying to understand, like, what are some of those you know, uh, environmental issues that can help impede one's ability to manage their health. And so 80% of our health is driven through the socioeconomic factors, and only 20% comes from the medical side. And so once you're able to understand if a person has access to safe housing, like, do they have any type of environmental issues when they're within their home, like mold that's exacerbating conditions like asthma, or are they able to afford their medications in order to actually be able to address their health? Do they have safe public areas that they're able to walk and exercise in and feel safe within their communities? All these different factors really contribute to our overall health and well-being. And so as we think about healthcare and preventative health, it's really important to make sure that we're kind of holistically looking at individuals. So from there, I graduated and went into healthcare consulting. And so I worked for the advisory board company and worked with their performance technology team. And, that was a great opportunity to learn a little bit more about the kind of business side of healthcare. And shortly after that, I had the opportunity to come back to the University of Maryland as a staff and join the Honors College Entrepreneurship and Innovation program, and help to lead their work and really help to build out curriculum and programming around social entrepreneurship at the university. And from that opportunity and working there for a number of years, I earned my master's in technology entrepreneurship. And really, like, how can you leverage technology in order to not to have a double or triple bottom line? So not only be driving profits, but also thinking about how can you drive, like, social outcomes or environmental sustainability goals as well. So from there, received a really exciting opportunity to join AARP Foundation as a social entrepreneur in residence. And at the time, AARP Foundation was really kind of reimagining the way that their work operated at the foundation. So traditionally, they had operated a few programs at the national level. Their tax aid program, which helped individuals complete taxes for free. So other workforce programs, but they were really trying to think about how could they solve these big societal issues and really do it in a social entrepreneurship driven way, in which they were trying to think about sustainability for programs that lasted beyond just the traditional model of going after federal funding or philanthropic funding, and really think about how could you build business models that aligned with these double and triple levels of impact. And so came into the foundation to lead their social isolation and loneliness work. And really, during my tenure there, kind of worked at the intersection of understanding how technology could be used as a catalyst for human connection. And from that work, also kind of really got deep into affordable senior housing and some of the increased prevalence of isolation and loneliness that we see within those types of settings, and became an advocate for ensuring that older adults not only have access to technology, but really access to reliable, affordable broadband, and training on how to leverage technology in order to help them maintain their independence, their purpose and their passions, and really have that ability to use technology in a way that younger generations have had the ability to use it growing up native to these tools, or having the support to be able to kind of understand how technology can play a really important role in everyone's individual lives. So, it's been a little bit of a circuitous route to get there, but really within that role, developed a lot of subject matter expertise in social isolation and loneliness, especially in relation to older adults, and that became an even more important topic when we had the 2020 pandemic that occurred, in which everyone was facing isolation and loneliness, and helped to lead a lot of national kind of initiatives around that, which were really fun and exciting.
Yeah, yeah. It just opened up a lot of opportunity to deal with that important issue. I don't think it's only older folks. There is social isolation everywhere, right? So that's one of sort of the yields of that terrible crisis, right? Is to become aware that this is a real problem. So
Yeah.
would it be fair to say that, and it may be a prevalent problem. There are resources. This country is very wealthy and so on, and there's money and all that. And what comes in the way is number one, awareness, right? Hey, you could do this, and that, and all of a sudden your life becomes much better, right? And so that's sort of, if we want to call it the last mile, if I want to use that. Is that where the entrepreneurship comes in? Perhaps is where you're trying to go beyond simply let's raise more money, and say, well, let's be smart and let's understand where the problems are in terms of folks being able to take advantage, like education, right? You educate them about a couple of things and how to use LinkedIn, whatever. All of a sudden, a whole world of opportunity opens up for them. And that little effort that you made, if we want to call it little effort, all of a sudden, just you can't even put a dollar amount against it, right? Is that what? Tell me more about what you mean by social entrepreneurship, and then do you agree with my earlier point, which is it's about not more resources, although we could always use more resources, but about getting there, getting folks to access those resources.
Yeah, those are a great questions. So on the kind of social entrepreneurship side, I think when I traditionally think about social entrepreneurship, right? It's like, how are you aligning business incentives with economic outcomes in order to drive a business model that could sustain a business or a company, and really ensuring that as you're making decisions within that enterprise, you're weighing both the economic outcomes of the business equally alongside the social benefit that you're trying to achieve.
Give me a
So when Oh yeah.
Ryan, give me an example. So
Oh, I was just about to. Yeah.
sorry.
Yeah, you're good. So when I think about that for like older adults, and I think about their overall health and well-being, so we know that there is an economic cost to social isolation and loneliness in older adults. So older adults and who are socially isolated and or experiencing loneliness have a 50% increased risk of mortality. They have increased risk of dementia. They have increased risk for heart disease. They have, this is a little bit dated back, but the National Academy's study found that they were annual increased Medicare spending of around $1,600. So when you think about the dollar costs associated with dealing with the negative outcomes of social isolation and loneliness, there is a financial return in thinking about if you were to solve this issue, you could improve their overall health and well-being and lower medical care spending for older adults, and potentially increase their longevity, their ability to age independently in the community, delay transition to an institution or nursing home care, which is a really really high expense for Medicare and other types of systems. And so the a lot of managed care companies have recognized that there is this big financial opportunity to improve the well-being of older adults around these domains. And then also Medicare has recognized the social connection as one of the areas that they measure their quality scores within their plans. So how the federal government actually rates their overall well-being as it relates to health-related social needs. And so if you can improve social connection, they can also see higher boosted payments for their members under their plans. And so there's been a lot of companies who've really kind of sought to understand, what are the different levers that you can do in order to help facilitate connection for older adults. So, like when you think about the different kind of points of opportunity within that, right? You mentioned awareness as kind of one of those first stages, right? So when we think about isolation and loneliness, I think oftentimes people aren't fully aware of the downside risks of being isolated and lonely. And so having some ability to do a screening, whether that's at the point of connection with your primary care doctor, your annual Medicare visit, whether that's, being asked in a routine setting to really kind of have a assessment that really helps identify, are you at risk of isolation and loneliness? Are there potential intervention points to then connect an individual? Understand like what is your frequency of social interaction? What is the strength and quality of the social relationships within your life? So do you live alone? Do you have a spouse? What's the quality of the relationship with your spouse? How close do your children live within certain proximity of your home? Do you have a number of friends within a proximity of home? How often are you interacting and engaging with them? How often are you participating in activities that give you purpose and give you drive? And so I think that's kind of one of those first areas that we've seen a lot of organizations and healthcare entities really try to figure out, like, how could they just increase surveillance of social isolation and loneliness. And then there have been other types of interventions that have been developed for social isolation and loneliness that have really been developed out of different treatments for depression. So there's an evidence-based program called PEARLS that was developed out of Washington State that used cognitive behavioral therapy techniques to do problem solving with older adults and behavioral activation through a kind of regimented process and working with individuals to identify, like, what are your goals in social connection? What are the barriers that are preventing you from being able to do the things that give you meaning and purpose? And so an example could be you are someone who has gardened your whole life, and now you find it really difficult to get down into the garden, to bend down. Maybe you're arthritic or having mobility issues. So thinking about, okay, is there an opportunity to have a raised garden that you can, more easily, participate in that activity? Are there different garden clubs that you could participate in? And really kind of working through those self identifying solutions to kind of figure out how you can participate in more activities that give you pleasure and purpose. Um, but on the technology side, as we enter into this ever evolving and shifting landscape of different programs and opportunities that might be available to you, it's like really, really complex to navigate these different systems. So everything has shifted from being able to show up in person at a store or a location and receive help to transitioning to telephone service call-in centers in which you're able to access a real person, and then now that's not available anymore. So being able to like navigate and apply for different programs has become really difficult for someone who's not a digital native or doesn't have ready access to smartphones, to a computer, to a tablet, to the internet, knows how to operate these systems. And it's almost impossible to get a hold of a real live person. So I think there's a lot of opportunity in the kind of generative AI space to really think about how different technology solutions for older adults, different agents could help navigate and simplify these experience for individuals to be able to successfully remediate some type of issue with their billing, to be able to enroll in online courses or classes, to be able to access different benefit programs that might support their ability to be more independent. So I just think technology back in the days when you and I were first kind of starting in understanding how older adults could leverage it has really shifted to becoming more universally um, accessible for individuals. Whereas we thought back in the day, like the promise of voice first technology and the ability to interact with technology using your voice because we all speak was a great opportunity to be able to introduce technology to older adults who weren't as comfortable in leveraging other types of interfaces through screens, to like where we are now, in which you have technology that can really begin to navigate itself through these complex systems and help people and engage in a more natural way than a lot of how interfaces have been designed in the past.
Well, you're the easiest person to interview. I just ask you a question and then.
I'll just keep going forever.
No, I love that. I love that. No, you have so much to share. Yeah, we have like 3 minutes to go. I have another.
Sure.
But
Yeah, I did it down. There's a lot of
no,
nonsense in there.
we need to do two or three more of these. In the next few months, if you have.
Sure.
Because you have so much to share, and you're positioned in this very strategic place. You're comfortable with technology, and then you know a lot about policy. You know a lot about these issues. You've studied it for real and so forth. So I think you're a pretty unique character, if I might put it that way.
Oh, thanks.
No, in terms of technology means nothing unless it is usable, and we've seen that
Yeah.
with the smart speaker, right? Smart speaker, and I think there is a next iteration of the smart speakers where the key problem of ease of use, right? You need to be able to talk to it naturally, right?
Yeah.
It cannot interrupt you, it cannot speed you up, it can't hurry you. You don't have to call its name every single time. All these things are about to be solved. With the AI that we have today, I think they're getting close to being able to deliver an actual, truly conversational agent. And imagine, right? It truly not like what we have now, where it's just annoying, right? Where you can talk to it and understands and think about all the possibilities. So hopefully we will see that. But I agree 100% with you um, that we need to tend to those, the micro details of across the board, where it's user interface or whether it's the system and how it works and where the bottlenecks are, to be able to deliver the massive potential, value potential out there. Okay, well, this 30 minutes went by very, very fast, dude.
Yeah. Well, also, as you're like, I think that what you said was really important is to identify like where the pain points are and the bottlenecks. And I think it's also really important as we think about older adults and technology is like, are we solving problems that, the older adults are experiencing? Because what I've seen in the aging space a lot of times is people are solving their perception of problems that
Yeah,
older adults have,
no,
or they're having the problems that their parent, their loved one is having,
yeah,
that is creating the issue. But from that older adult's perspective, it's not a problem for them.
yeah,
And so one of the I was just recently having this conversation with a friend who his mom is aging and starting to experience some memory decline, and she doesn't get out as much. She self isolates and a lot of these things, and kind of talking about solutions. And he was trying to explain to his mom the importance of like getting out, like interacting and engaging, in order to like stave off all these bad things, right? Like that happen from self isolating.
yeah,
And I said to him, I was like, you're taking the wrong approach. You have to really try to understand like what is the thing that gets your mom excited? What is the thing that is a catalyst for her passion? And how can you connect her in with those types of communities that really engage those aspects of her life? Because, we like I work out. I don't like to work out. Every day it's a chore, but like it's trying to find the activity that is exciting to me. So like I do rock climbing because it's like problem solving and it's not like lifting weights. And I actually do like virtual reality workouts because I grew up as a gamer as a kid and it feels like playing a game. And so like it's these different types of pathways that have really helped me find the right solutions for me to be able to live a healthy lifestyle. And so I think we also need to be thinking about that when we're designing solutions for anyone, but especially for older adults, because what we think that folks need is not what they think they need. And if
yeah.
you're designing it that way, they're not going to use it, and then you don't have anything at the end of the day.
Yeah, absolutely. I'm gonna leave it on this note, the following note, which is, people think that AI is gonna replace and all that, and some jobs will be replaced, but one job that will not be replaced is the UX researcher, meaning the person who goes in the field and talks to people and understands inside out what motivates them and so on and so forth. That requires human to human kind of
Yeah,
conversations. I think that's where a lot of, and that's where real value comes out. That's where you don't waste
yeah.
money and time building stuff that nobody's gonna use, right? So I'm optimistic that this AI is gonna improve, is gonna open up, right, opportunities for folks to go and do that kind of work. Because beyond that, once you figure it out, now we have the tools to create prototypes quickly and go back to the
Yeah.
field, and right, which means that hopefully we'll start having excellent products, scalable in terms of not just folks who have a lot of money who can do this, but anyone can actually go and do some field study and create a beautiful, wonderful product that makes somebody's life better and easier. Ryan Elza, thank you so much. This is probably the fastest feeling kind of conversation I've had in a long time. Thank you for
Well,
this.
thanks, Ahmed. No, I really enjoyed the conversation, and
Wonderful.
hope that we can chat again soon.
Oh yeah, absolutely. I'm gonna go and hop your time for sure. Thanks a lot, Ryan.
Thanks.